So tonight we're going to talk about one of my greatest passions, and that's education, and specifically education for breast cancer patients and for patients that are interested in learning about breast cancer. But before we get started, I do want to share a few things about myself, especially for those who don't know me or who may not have been to one of my presentations in the past. So that's me. When I was about 2 years old, my name is Dr. Bednarski, and I was born in Poland. This picture was taken in Poland, and I moved to the U.S. with my parents when I was 8 years old. Since I was very, very little, I knew I wanted to be a surgeon. In fact, that's one of my first patients. Actually, she is my first patient. She's still with me. This photo was taken just yesterday. So as a child, I would perform very, very innovative and successful surgeries on this koala. She was always fully cured. She may have lost a few nails in the process, but... So I did realize my dream, and I became a surgeon. I went to medical school in Kansas City, and then I did my general surgery residency in New York City. And I initially finished a hand and reconstructive fellowship in the South Bronx. So I stayed in New York, and I worked in New York as a hand surgeon for over 3 years. I really enjoyed that, and it was fulfilling, but my passion to help women really prevailed. And I knew that that was truly my first passion, and I went back and I did another fellowship in breast oncoplastic surgery, and that was also in New York. And I am incredibly fortunate as a physician. I've been practicing for over 19 years. I've focused exclusively in breast care for over 11 years. And I live by a very simple principle, and that's patients first. My patients are everything to me. And they all have my home phone number, my cell phone number. They all know that they can reach me anytime, day or night. And I truly live by that principle. And I have so far been able to care for patients in quite a large area of the Midwest. And I've cared for over 2,000 patients so far by myself. So do you know where we are on this map? Let me help you. So that blue circle is here, St. Louis, and the green circle is Maryville. That's where my practice is. And so a few years ago, we did this little exercise. Oh, hold on. I'm going to zoom out. Hold on. First, I want to zoom out. We're going to zoom out a little bit. So this is kind of the southern Illinois and Metro St. Louis area. So a few years ago, we did this exercise where we actually mapped out all the different zip codes that I have seen patients from. And this is what we came up with. And actually, this map is now much larger. I have seen patients in Springfield, Illinois. I've also seen patients in Springfield, Missouri. And so patients have driven more than 4 hours to see me, which I think is really incredible. It makes me feel so incredibly fortunate to be able to take care of those patients that they have chosen me to be their doctor. So why do patients travel so far to see me? What do I do that's a little different? Well, I provide truly comprehensive breast care to patients of all ages, men and women. I treat benign and malignant breast problems. I perform everything from biopsy through reconstruction, and I can also help a patient anywhere along the path. So if they've had surgery with somebody else, I can pick up and continue. It doesn't matter. I can help anyone at any point during their journey. I also perform cryoablation, which is the freezing of tumors without surgery for benign or malignant causes. And that is something that nobody else in the St. Louis area does. It's something that nobody in Chicago does, nobody in Kansas City does. There used to be somebody in Detroit, but not any longer, so I am truly it for this area. I also do breast reconstructions. I do breast reductions, lifts, and revisions of cosmetic surgery that just didn't go right. And if a patient has breast cancer, I hold their hand throughout their entire journey. I actually take the place of 3 physicians: a surgeon, a radiologist, and a reconstructive surgeon. And I am all boobies all the time. That's what I do. So in fact, if you actually go online and type in allboobiesallthetime.com into the URL, you will come to our website. So in all of these years of being a surgeon, taking care of so many patients, I've learned a few things. Breast cancer is a really big issue. It affects women far beyond my physical reach. This year alone, over 268,600 new cases of invasive breast cancer will be diagnosed in the United States alone. And this amounts to 1 in 8 women affected in the US. And here in the US, our survivorship numbers are amazing. They really are fantastic. We have close to 2 million survivors. It's really an attribute to how well we take care of our patients. But worldwide, women are not as fortunate. So in 2012 alone, 1,671,149 women were diagnosed with this disease. And 521,907 women died in 1 year. And that's twice the number of women that we diagnose in the United States per year. So what else have I learned? Well, when patients hear of a breast cancer diagnosis, one of the first questions is, "Doctor, am I going to die?" The fact is, breast cancer is not a death sentence, but you have to be smart about your options. And the problem is that a lot of women don't really know where to go to know their options. As breast cancer specialists, we have learned that breast cancer is a family of diseases. It's not just one disease. And I tell women this every single day that I'm in the office, even when I'm not. The breast cancer that Angelina Jolie or Suzanne Summers or your mother or your neighbor or your sister or anybody else had is not necessarily the same breast cancer that you have. And breast cancer does not necessarily mean having your breast removed. And unfortunately, patients have a lot of preconceptions about what the diagnosis means and what it means for their future. And they often will rely on social media, Dr. Google, to get their questions answered. And unfortunately, these resources have really made mastectomy mainstream. And sadly, in the United States, less than half of women who undergo mastectomy are offered breast reconstruction. There are actually laws being put into place to help change that, but right now, that is a fact. And there are things that patients can do to minimize their risk of having breast cancer. Patients often don't understand how breast cancer starts or how it comes back. As physicians, we truly are not able to spend the time educating our patients. The United States healthcare system does not allow our physicians to do so. I think I need a Kleenex. So, patients go to their doctor and they go there to get a pill or a procedure. So they go there to get a pill or a procedure. They don't go to get educated about their health. So what does this mean for the patient? Well, in today's society, a physician's success is often counted by how many patients they see in a day. So a physician who sees 40 patients in a day must be good, right? They must be good because they must be able to take care of so many patients. But the fact is, if you tally that out, that's 12 minutes a patient. Is that truly enough time to talk about breast cancer, nutrition, health, wellness? Nothing. It's nothing. It's no time. Remember that statistic about women not being offered reconstruction after mastectomy. One of the biggest reasons is that physicians don't have time to talk to them about it. And this is why you can't fault patients. This is why they go to Dr. Google. This is why they go, because they want to get the answers that they haven't gotten from their doctors. And these are just a few of the many, many, many questions and concerns that are brought up by patients and their loved ones. So how are we solving the problem now? Well, unfortunately, we aren't. So ideally, your questions should be answered by your physician. But doctors are often focused on putting out fires, giving emergency care. You go to your doctor when you have a cold, when you have a broken foot, when you have a bad back. You don't go to learn about health. If your blood pressure is high, you go to get a pill. You don't go to get to the root of the problem and figure out when was the last time your doctor talked to you about your exercise schedule, your diet, or mindfulness. And prevention of disease often will take a back seat. And the patient's social circle becomes their media advice panel. Once someone goes public about their diagnosis of breast cancer, they get really inundated with well-meaning friends and family offering advice. And they'll often not be able to discern fact from fiction. So their social circle becomes their medical advice panel. They also reach out to social media. And there's no question that the people that post on social media are well-intended, but unfortunately they give information which is biased and limited by their own experience. And Dr. Google is another frequent source because Google does a fantastic job at finding information, but not about you. So Google, hopefully, Big Brother is watching, but hopefully Google does not know your family history, your prior breast procedures, your age, your race, any sort of pre-existing conditions you have, the times that you've been pregnant, how many of those pregnancies you brought to term, medications you're taking, your genetic predisposition. The fact is that Google does not know this, so they can search and find lots of information, but not necessarily information about your specific disease. Remember I said earlier that breast cancer is many, many different diseases. So this is my own experience. I dare to say that it's probably just about everybody's experience in this room. So don't you agree that there should be a better way? A way that you can learn more about breast cancer, what causes breast cancer, how to prevent breast cancer, what things are you doing today that will decrease your risk, what things are you doing today that you can change so that your risk is not increased. If you've had breast cancer, how do you get your life back? How do you navigate through the complexities of dealing with this disease? And if a loved one had breast cancer, can you help them in their journey? How can you live a long, happy, healthy life? And probably most importantly, how can you achieve normalcy? So what if there was such a place where you would have access to reliable, trustworthy medical information? What if that information was based not on personal experience, but on science and research? What if you could have access to resources, everything from nutrition to breaking the news about your diagnosis to your family and friends? A place that specializes only in comprehensive breast care and breast cancer education. A safe place where like-minded people can meet and discuss their struggles. You could ask questions of an expert who specializes in your concerns. You could learn how to regain control of your body. And you would have access to available resources. A platform that can be accessed by patients and their loved ones all over the world. A way to build a loving, trustworthy community. A way to reclaim you. If you agree that yes, there should be a better place to get smarter about breast cancer, I may have something for you. So tonight, I am thrilled to share with you a platform that is a foundation to address exactly these problems and concerns. And we call this prevention versus detection. Yay! Yay! You wouldn't know otherwise, right? So our goal is to become your online resource to help you navigate the complexity of breast cancer. We want you to become an expert in you so you can have a normal life again. You can search for content, you can browse the 3 main areas of prevention, detection, and health. And this way you can find information that's truly relevant to you. So we bridge the gap between the education that you get and the education that you must have. So this is actually available tonight at preventionversusdetection.com. And if you don't mind, I'd like to give you guys a tour. All right, so this is actually our website. It is live, so there are several features. So as I mentioned, there's prevention, which talks about prevention of disease. We have several categories below. We have a tab called detection, which is about everything from an exam to imaging options to procedures to preoperative and postoperative care. And then we have a tab on health, which is going to help us with putting out new recipes, news that is coming up, information about supplements, menopause, and a lot of other things. So you can do a search. So I'm going to type, oh good, okay, vitamin D. So if I type vitamin D, this is searching the entire website. So this comes up as an article, Misconceptions About Vitamin D. And if we click on that, not only do you get the article, but you have here an email function and a print function. So you can actually print this out, give it to your doctor. You can email it to someone that you love. And so you can share the information that way. There's this really cool Ask Dr. Bednarski button. So this is a place where if you don't find something on the website, you can email us and ask your question. Again, I just want to remind everyone that this is not for medical advice. This is for knowledge. And so if you have a very specific question, then the best person to ask is me directly in your office visit, or ask your doctor. But if you have a general question that can be answered generally, I'm certainly happy to do that. We recognize that this website right now is somewhat limited. We do have some articles, but obviously it's not as robust as we imagine it will be. And all of you can help us make it more robust by asking the questions that interest you. Go back to home. Now, also, I'm sorry, I want to show you guys. So if you click Ask Dr. Bednarski, this will pop up a little, is it supposed to pop? It's supposed to, right? It's thinking. Okay, so this will pop up a little questionnaire. I was supposed to do that, right? Okay, all right. I'm like, wait a minute. Okay, so this will pop up a little questionnaire. So you can tell us what exactly you want to learn, the specific question you want to ask, your name, your email, so we can address you directly. If you want, you can give us your phone number, and again, a little disclaimer, and then you can just submit your question. We are HIPAA compliant, but that does not mean that we want to know everything about your disease. And then also, we have this Get Involved button, which is a similar little survey, and this, we want our community to also be a part of this as much as possible. So everyone is encouraged to let us know how you would like to be involved with this. So obviously all of the different things that you can get involved. If you have a specific talent or something that you already had in mind that you were wanting to do with us, and then obviously your contact information. I think that's everything, right? Oh, yes, of course. My goodness, how could I forget? This is also available. It's responsive on your mobile device, so iPad, cell phone, Android, iPhone, doesn't matter. It's all there as well. So you can see our website is completely responsive mobile. And that's it. Okay. All right. So close your eyes again, everybody. The site is publicly available tonight. This is just the beginning. So whether you choose to use our site or a different resource, it is so incredibly important that you get educated. And if you want to take advantage of our site, you'll check out the website from your desktop computer or from your mobile device. You can search or browse the website to learn all about breast cancer. We will be posting new content every week. If you don't find something that you want, as I mentioned, use that Ask Dr. Bednarski button. And this is not a forum, again, for individual medical advice, but for education of all. So if you do ask a question, the way that it will be answered is in a newsletter or in an article on the website. And of course, we will remove any sensitive information that you may share. So this is just the beginning of an incredibly ambitious project. This resource is not just for breast cancer patients. It's for anyone who wants to learn more about breast cancer prevention, whether they are directly affected by this disease or not. We want to help you become an expert in you. If you have a question, just ask. And again, the answer will be posted either in the website, in Facebook, or in a newsletter. And that way everyone can learn from your questions. So next week, we're going to start sending out our weekly email, or our weekly newsletter by email. So if you haven't signed up, for those of you that are here, please do so. That's the way that they're going to go out. It's the best way to stay current. And we'll let you know when we publish new content. On Facebook, we will always post our new content to the page, so people will know there, so you never miss out. We're going to continue making efforts to grow our prevention versus detection community. And we're going to, this is, as I said, ambitious. We're going to have different sections of the website that are going to be rolled out. So we are going to have an expert panel, so you can benefit directly from our experienced professionals who know about breast cancer and related topics. We're going to have a video channel, and that'll be a convenient way for you to learn about prevention of breast cancer. You can also watch videos on your computer, phone, or internet-connected TV. And we'll have videos about everything from, as I mentioned, interviews to news to latest developments, how to do a self-breast exam, preoperative and postoperative care, so things like drain care. And Food First is going to be our recipe page. So Hippocrates said, "Let food be thy medicine." And cooking is truly one of my passions. It's something that I am so incredibly passionate about. It's one of the best ways to express love for those around us. And so we will be sharing, because I love all of you, we will be sharing delicious, easy-to-make recipes that will help not only make your recovery good, but also help you fight breast cancer, stay healthy, and we'll even share different recipes for food and drinks to make specific treatments easier. So I guess I'm making an actual statement about this. One of my goals for 2020 is to become a certified personal trainer, because I don't do enough. So that way I can really focus on helping my patients with their exercise regimens. So we're going to post videos of exercises, guides, plans, routines, things that you can do at home to help your recovery and to help you stay healthy. We're also going to have a resource center. So a resource directory for bra shops, mastectomy boutiques, for prosthesis options, wigs, hairstyling. We're going to have a section on nipple and areolar tattoo artists, and imaging centers, and many, many other things. So if there's something that you feel is missing, again, click that Ask Dr. Bernardi button. I truly believe that access to scientific, reliable information about breast cancer will help women all over the world. So another portion of this is we do plan to do some translations. We feel that even though I've touched 2,000 women here in the area, Think of the millions of women that we can touch. So again, super ambitious. We know we can achieve our goals because we don't plan to do everything by ourselves. So for those of you that are here live, we're going to play a little game. So everybody should have a folder. I personally handed each of you a folder, so I know each of you has a folder with a pen and paper. So you're going to grab a clean page and your pen. Give you guys a few seconds to get ready. Don't write anything down yet. Just listen for a moment. So I want you to think about someone that you know, a friend, a family member, a neighbor, a coworker, who might benefit from the information that we're going to be sharing on the website. Someone who would benefit from learning how to prevent breast cancer, to reduce the risk of breast cancer, healthy foods that will keep them even healthier, learning how to stay active without killing yourself at the gym, and benefit from being able to ask questions directly to a professional. So do you guys have some names or a name? So I'm going to have everyone put their pens in the air. Do you have a timer? You don't have a timer. Do you have a timer? Are you ready? Get a timer. People are waiting. Okay, keep your pen up. Keep your pen up, pen up, pen up. What? You got the timer? Okay. So, when I say go, you guys are going to write down 5 names. The first person to have it 5 names, jump up and say bingo. I don't know. Jump up and let us know. All right, ready? 1. Or here, I'll let you count down.
1, 2, 3, go.
All right, and they're off. Oh, you're done? Okay, come on up. Let me see. Let me check your work. Do you really have 5 names? I believe you. I believe you. You get our cool prevention versus detection bonus. Thanks for playing. We will have more prizes at the end, so don't go anywhere. All right. Okay. So, back to this map. But you guys all have your lists, right? You're not going to throw those away because we're going to talk about that in a minute. So you guys remember this map. So this is how far I've been able to go just by myself, and this is how many people I've been able to help. How far can we go, right? How many people can we help if each of you contact those 5 people on your list, right? And what if those 5 people contacted 5 each, and 5 each, and 5 each, and 5 each? We would have this amazing ripple effect. 1 in 8 women in the United States will be diagnosed with breast cancer this year. How many lives can we save if each of you make a commitment? So this is where we're going with this. I think you guys can all help us. And we can get there, hopefully in time, to save the lives of women that we love. Before we close this event, I'm going to ask all of you one more thing, including those watching from Facebook Live. Hopefully you have somebody with you. Before we close the event, you're going to each look to your left and to your right and tell the person next to you, I'm committed to help. Go for it.